Skylar. I'm going to be performing peri care on my client. I've already checked the doctor's orders and it is time for my client's peri care. I've already inspected their genitals and rectal area. So that confirms that I need to go ahead with the peri care. I'm going to go into my client's room. Knock, knock, knock. Hello, Mr. Johnson. My name is Skylar. I'm going to be your nurse today. I'm going to perform peri care on you. Can I get your name and date of birth? Alright, thank you. I'm going to provide you some privacy. And I'm going to wash my hands, put your bed in working height for myself. I've already assembled all of my supplies. My patient is in the dorsal recumbent position. They have a Chuck's pad underneath them, not to get the bed wet. I have a bath sheet on them with their legs bent up to provide privacy and not to overexpose my client. I've fan folded the sheet down to the edge of the bed. Now we're ready to begin the peri care. I've already put my gloves on. I have some warm water in my basin. I'm going to start by using a damp washcloth. I'm going to go down the side of the labia. I'm going to make sure I don't go over anything that I've already washed. I'm going to rotate my washcloth every time I make a swipe. I'm going to go from up to down towards the anus. I'm going to use the antiseptic solution on my rag, and then it's going to drain into the basin, and then I'm going to discard this into the trash and put the dirty linen in the linen basket. If my client had a urinary catheter, I would be sure to clean that appropriately. For a male client, I would grasp the penis, and if he is uncircumcised, I would retract his foreskin and clean the tip of the penis with a circular motion, being sure not to go back over something that I've already cleaned. And then I would immediately go retract the foreskin, go down the shaft of the penis to the scrotum, and then I would spread his legs and clean the scrotum. So pat dry the scrotum. And now I'm going to go straight in and turn my client so I can clean the anus. You put your arm on your shoulder. Duct tape there. Alright, with the clean rag, I'm going to wet the rag. Fan fold it. The anus from front to back, making sure I don't go over anything that I've already cleaned. I want to toss that into. I'm done cleaning the anus appropriately. I would rinse it in the same manner and pat dry it. And then I'm going to take this soiled absorbent pad and throw that in the appropriate receptacle. If she is menstruating, I would put on a menstrual pad. If my client is menstruating and if there's any excess secretions or drainage, I would place a clean, dry, absorbent pad underneath my client. I would make sure to get any damp linen, throw it in the right receptacle, and properly dispose of my supplies. That includes rinsing my basin and drying it. And then I would I'd be sure to remove the bath blanket and fan fold the linen back onto my patient. Put you back in a comfortable position, Mrs. Johnson. going to give them a call light. Do you need anything, Mrs. Johnson? And then I would wash my hands and remove privacy, and I would go document my skill.